And
Okay?
Dr. Muhammad, if you could explain to us how the blood clots would move from the legs and
Excellent.
around
Excellent.
to the lungs and the heart.
Excellent. So if you allow me to
Yes.
explain, so these are the deep veins of the lower extremity. Remember, deep veins because they are inside the muscles, different from the superficial veins that are affected by what we call varicose veins. Varicose veins, they are under the surface of the skin. They can have clot, but it's not risky because it does not detach or move to the heart and to the lung. So usually it will cause some sort of inflammation, reddening, red, hard. It will be palpable like cord. This is people who have like what we call varicose veins. We are talking about
most of the females. We have this.
definitely.
We know.
We are talking about the veins inside the muscles. We call it deep veins. Okay, it's different. Once it forms below the knee, we call it distal. This is away from that. This is less risk to go to the lung. If it is above the knee, like here, the veins in the thigh, it can detach. So if you have, we call it proximal or near to the heart, this is higher risk of detachment, and we call it embolization. So more than 50%.
It could reach easier.
Yes, easier and it's closer. Okay, so it can go from this and to the inferior vena cava. This is in the abdomen. Then go to the right side of the heart. Just to show you, okay, that the heart formed from 4 chambers. Can go to the right atrium, right ventricle. Then this one. This is the main pulmonary artery. In 10% of cases, it can occlude or obstruct the whole main pulmonary trunk. Cause death.
And this pulmonary trunk is the one that is responsible for spreading the blood all over the body.
This is
so if it's closed, means that no blood is going to go to anywhere.
Yes, we have venous systemic circulation and we have pulmonary circulation. This is the pulmonary circulation. If the blood is not flowing, the patient have shock. So this can cause death within 1 hour. And this is in 10% of cases. That's why prevention is better than cure.
True.
We can prevent this easily. And once you have it, if you diagnose early, you can prevent complication. Because this is important, depends on the size. That's why people, they ask, what's the relationship between the blood clot in the legs and blood clot in the pulmonary artery. So I hope I was clear in this regard. Okay, it can be small. See the one? It can be clothing this small veins. We call it distal. It's not proximal. I mean, excuse me, I'm using medical terms sometimes, but I'm trying my best to explain it in a plain language, okay? So this is just regarding the venous thromboembolism, which can include both legs and
let's get to the important part, Doctor. And now we know the procedure and everything, but since we have an awareness day in these regards, and we've been talking about prevention, tell us about some of the major steps for prevention. You mentioned some in your discussion, but still we need the list.